Oh, my camera falling. Oh, that's hilarious. All right, we're holding this. Good morning. Can you guys hear me? Can you hear me? I hope you can hear me. Try to get all fancy and put my phone up so I could just like sit back and chill. No, I need to. I'll fix that later. All right, let's see. Let me add in. Okay, good. Let me add in my girl. Hold on.
Hey, can you hear me?
Oh, hello, pretty girl. Yes, I can.
I think we might literally be matching
Okay,
our pajamas.
are we wearing matching PJs? Yes, we're wearing matching
That's
PJs.
incredible.
Incredible. In I am very happy about that. I am
That's
very happy
amazing.
about that. That was meant to be. See the
It
Lord, how the
was.
Lord works. This is great. What's going on? Okay, first off, before we even get into stuff, wait, you had a baby shower today or a birthday party? What did you have today?
No, so yeah, like a birthday tea party. So my oldest, my stepdaughter
Oh,
turned 19 this week, and so
nice.
yeah, and they're amazing. So anyway, I took them and some of their friends to
Oh,
like a high tea service.
I love that. So
Yeah,
so femme, so girly.
so fancy.
Like why
Yeah,
not? You know,
yeah.
so fancy.
My eye makeup did have like all these like crazy swirls around my face. They did my
Ooh,
makeup. And
ooh,
I was like, that might be a little
wow.
much for this live. So I tried to
Wait,
laugh.
it was a tea party and they do your makeup at this thing too?
No, no, no. My teenager did my makeup. They do
Ah,
amazing makeup. So
love
generally
it.
anytime I'm going anywhere with them, they do my makeup. Yeah.
Perfect.
Yeah. Yeah.
I love that. Oh my God, I'm so glad we're doing this.
Me
Welcome, by
too.
the way. So you know, welcome to Dubai. It's 7:07 a.m. Let me give you a little. The sun is not all the way up. Hold on. It's kind of
Oh,
getting there.
nice. All
It's kind of
right.
getting there. But it's sunny and it's nice. Like it's like chill this morning. So we
Yeah.
are here. I'm so
I
glad
am
we were able to have this
jealous.
convo.
Yeah, I'm jealous of the 70
How is it?
degrees. Not that it's really that
Oh, I
much
know.
colder in Austin, but my house is 65 degrees because my husband likes it frigid. So
Oh my
I'm
gosh.
always
Same with
cold.
mine. Same with mine. Like, why are they like this? I don't understand. Why does it have to be 65 degrees all the time?
Yeah, I don't know.
Like, and what I don't understand even more is I'm like, husband, you advocated to move here to Dubai, yet you want it to be 65 degrees all the time.
Well, for
Help me
the
understand.
topic that we're talking about, my husband, whenever we
Yes.
were going through all of this stuff, was like, "It's better for the sperm, babe." And I was like, "All right, okay, we're reaching, but
Okay.
all right."
All right. Reaching, reaching. Love you for that, though. Love you for that. Oh my gosh, I'm so glad we're doing this really quick. And I'm so glad you were like open to doing this random format. Like, I don't, you already know, we've talked about this. I go live, like, I've been doing this thing of going live every day. And this whole topic around, obviously, a lot of my life right now is this fertility journey. I just ended 7 cycles of IVF. And
Yep.
so I've been like really purposeful about like, hey, I'm just going to share what I'm learning this whole time. And I'm getting so many messages from people who were like, "Oh my gosh, I just went through it. Oh my gosh, I'm about to. Oh my gosh, I'm nervous about it. Oh my gosh, uh, what vitamins are you taking? Oh, just so many questions." And I'm like, how is there not more information about this journey? And then on top of that, I listened to the Dear Future, excuse me, I keep doing this, Diary of a CEO 2-part series on women's health, 7 hours that just blew my mind about all the things that, quite frankly, our healthcare professionals never taught us, or quite frankly, probably never knew to teach
Yep.
us
Yep.
about our bodies. And so you and I have been chatting about this, and you're like, girl, like, I went through all of this. Yeah, I can tell you all the things. And you were so gracious and open to like changing our little FaceTime that we would have done it anyway into a live. So I really appreciate it. But for anybody that is like on and doesn't know who you are, maybe give them like the skinny, because I know
Yeah.
you, Avi, but
Yeah. No, happy to. So let's see. Okay. I am also a tech executive. Esther and I met when we were at Cisco. I think we actually met the year we went to Chairman's Club. So we met
babies.
in Hawaii. Yeah. And we were babies.
That's
Um,
right.
and we
That's
have,
right.
yeah. Yeah.
You know, so funny. I was looking up a picture of. I saw it on your Instagram, a picture of us on stage years ago with with
Allison Gleason
uh yes, yes, and
and
I was like, oh my god, yes, and Tammy, and I remember that I was like, oh my gosh. But then you're taking me back. I'm like, no, we actually met at Chairman's Club.
yeah.
We
Yeah, we
actually met at
did.
Chair. That's right. You were
And
such
we
a
were
boss.
and we were both still ICs, which is wild too, because then we went on to be
Yeah,
leaders and all kinds of stuff. But
yeah.
more than that, I feel like from like the moment I met you, you became like a champion, and that surprises no one. You champion everyone in their life, but you
I
were always kind of
appreciate
like
you.
cheerleading for me at work, personally, and so on. And so, and then
Yeah,
the reason
man.
we're
You
doing
make it easy, child. You make it real easy.
thanks, Ed. But the reason we're doing this today is that I, got married in 2020, um, which is a whole other fun story. But I was, let's see, I'm 39 now, so whatever that made me, 34. My husband and I decided to, start trying to have kids pretty quickly because for a whole variety of reasons, but getting older was one of them. And I went through recurrent pregnancy loss. So, and I didn't actually do IVF, but I came very, very close. Like I had $5,000 worth of medication in the fridge, was supposed to start a stem cycle, and that's actually when I got
Mm,
pregnant with my
mm,
son. But
mm.
yeah, my trouble wasn't getting pregnant; it was staying pregnant.
Mm.
And so, but I just kept being told that it was bad luck. Oh, that's bad luck. Nothing's wrong. It's just bad luck. And I was like, that can't be true. That's not true. I know
Yeah,
it's not.
it
And
isn't true.
so, like, I started getting second opinions, seeing other doctors. I flew to Costa Rica for this like specific doctor that was treating a friend of mine that was willing to do like we'll call it more experimental testing. I read a lot
Mm.
of, I literally brought some of my favorite books if we want to talk about them.
Oh my
But
gosh,
I
yes.
started
We
reading
will definitely do the book thing.
all of this stuff and like reading studies. And so I just started being like
Mm.
armed with the right questions that I would go in and ask. And
Yeah.
basically you just have to scream. You have to like scream at like your medical providers sometimes to like be heard about what's going on.
Yep.
I'm sure as someone with
Yep.
endometriosis, you know tons about that. Um,
Have to.
so yeah, so that's why we're having this chat. And I knew you were going through IVF. I saw one of like your lives where you talked about your vitamins, and I thought, you know what, I should ask, see if she wants to just chat about some of this stuff. So
I love this. I so
yeah,
appreciate you for that. Because honestly, I feel like the toughest part about this journey is it feels like you're the only one going through it. Like
yes,
it feels like you're the only one that has a specific case and a specific thing in a specific way. But in reality, most people, no, I'll say most people, everybody, every woman that is, let's say every woman that is 40 has been 35 before and has been 30 before.
yeah,
Most women, unless there is something wrong, has had a menstrual cycle. Yeah. Or
yeah,
unless there's something different going on, or unless you've changed anything, most women who are born with a uterus will have a menstrual cycle. And there are a lot of things that we have similar with each other that, quite frankly, um, unfortunately, the medical system doesn't have a lot of widespread tests that go back in history, widespread studies that go back far enough in history for there to be enough awareness about this. And I talked about this in like previous lives that like, you know, um, it wasn't until 1993 that women were mandated to be part of healthcare studies, not
yeah,
just thinking that women were just little men with boobs and a uterus.
yep,
Um, and we make up 51% of the population, so like quite frankly there should be a lot more studies around what we're going through. I love that there's a lot more focus now around more than just pregnancy. Unfortunately, that is the majority of where studies go, but there's so much more that goes that is part of the woman's body, your hormones, your like there's so much more that goes into it. Do you know what I'm saying? And so
Yes.
I just feel like we should talk so much more about all of the experiences and to know what is normal and what is not. One thing that stood out to me from the podcast is exactly what you said. Recurring miscarriages are not normal. Don't let anybody tell you that they are. And I'm
Yeah.
so glad that you were like, oh, no, 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 I'm going to advocate for myself. That is not normal. So like, what did you do? And like, what was the, sorry if this is like digging, but like,
Yeah.
at what point were you like, okay, this is not normal?
Yeah.
And like, what did you do?
Yeah. Well, let me go back actually before, well, so two things. One, to your point, 1 in 4 women will have a miscarriage. Like that is in theory how common, and I don't want to scare anyone out here who wants to have children hasn't yet, but it's so common to have one, to your point. But to having more than one is 1 in 100, like 1%. Less than 1% of women will
Wow.
go through, yeah, recurrent pregnancy loss. Um, but before we even started trying to have kids, my husband and I, so my grandmother died of breast cancer, and my husband's father died of a different kind of cancer, but 3 of his 4 sisters died of breast cancer. And we know that his sister carries a rare triplication of the BRCA gene. So we didn't know if he was a carrier, and we didn't know if I was. And so we decided to do genetic testing before we even got started. So we had to find like a
Mm,
reproductive endocrinologist, um, who would uh, basically prescribe this genetic testing. And we also just did like just the very basic. So if you try to have children and you can't after a year, if you're below 35, then after a year, you'll start getting kind of this testing done. If you're 35, it'll be within 6 months. That if you're trying to have kids and you don't get pregnant, they'll advocate that you get this testing. But it's important to know you can ask for this testing anytime. So the most common testing will be like something called day 3 labs, and it's basically like you start your cycle, and it's like day 3, 4, or 5, you get blood drawn, and they're just testing like your hormones. Your partner will
yeah.
get like a semen analysis, and those are kind of the two really really basic things. So we did those things, and we did genetic testing, just because we were already doing the genetic testing, and we were afraid that if one or both of us was a carrier, we were going to do IVF and test specifically for the BRCA gene. Luckily, we found that neither one of us carried the gene. We were like, it was
Oh,
totally
great.
miraculous. Yeah. So neither one of us had it. Semen analysis normal. My day 3 labs completely normal. They were like, go have fun, go try on your own. Call us if you're not pregnant in 6 months. Um, and we started trying, I think like January 2021, like 2 months after getting married. We got pregnant for the first time in June. And it was really weird. I,
Mm,
I had been trying to track ovulation. So let's go back to like one of the things you said, like in high school when they did sex ed, I don't think they explained to you like how your cycle worked or that like the
at all.
phases. No, like yeah, like
At
your
all.
follicular
And
phase,
I
your
would be
luteal.
interested. Honestly, I feel like I was today years old when I learned the different phases. Like I was telling my sisters about it, and they were like, "All right, Esther, here you go with your mumbo jumbo." And I'm like, "No, no, no. We actually should have like known this." So, like, there's so many women on right now. Did you guys learn this in school? Is it just me? Is it just me and Marjorie that didn't know this? Because I swear no one talked about that in sex ed. Like
No,
everyone, oh, you're gonna get a period, great, and then they talked about like childbirth and like you know, here's how it happens, like the sperm and the egg and all of that. No one talked about the
these are the
actual
five
phases of your
days.
cycle.
Yeah.
Yeah, these are the 5 days, the phases of your cycle, the hormones required, the hormone changes in your body. Like, no one talked about that at all.
Yeah. And I almost feel like they didn't tell us, hey, you can only get pregnant like on these 5 days of the month because they're like, then we're giving them license to have sex on the other days.
Yeah, yeah, yeah.
Or to be fair, maybe they would think we would get it wrong, which could be fair. It's a lot of
I
times like
mean,
this is also important for the ladies out there. If you are using a period tracker app, it's going to give you a prediction that is based on a common 28-day cycle. So if you report your period as the
Yeah.
1st of November, it's going to say that you ovulate probably on the 14th or 15th of November, and your period will start on the 28th of November. And it will change as you start to input your data. If you do 6 months of periods and it sees that you have a 30-day cycle, it'll start predicting that. But really, to find those 5 days, you need to be looking at your regular cycle length. You need to be taking ovulation strips. You need to be measuring your basal body temperature with an Apple Watch, an Oura
Yep.
Ring, or a thermometer. You need to be like
Yep.
looking for cervical mucus. Like there's so much you have to do to triangulate on it, right? Um, but anyway, so we got pregnant for the first time 6 months later in June. But it was weird because I had thought I hadn't been ovulating. Like I hadn't been getting any positives on ovulation tests at all.
Ah,
And but so I went in,
interesting.
yeah, but I went into my OB like for a cycle, for like a monitored cycle one time, and he was like, "Yeah, you're ovulating. Like I see the follicles developing." Then he was like, "Here's the corpus luteum. It proves you ovulated. Like you're," and he tested my progesterone. So he's like, "You're definitely ovulating. I don't know why you're not
Mm,
seeing the surge." He was like, "Maybe you need to test more than twice a day. Sometimes they're only 4 to 6 hours. Test three to four times a day." But so I decided for the next cycle, I would start like the day after my period ended to see if I could, like, maybe I'm ovulating earlier than I
mm.
think, I don't know. So it's like
Yeah.
day 5 of a cycle. I take the ovulation test and it's blazing positive. I'm like, well,
Oh,
that's
snap.
weird. So,
Okay.
I take to the internet. I'm like, is that possible to ovulate that early? Like, that doesn't even make any sense. And the main thing that actually came up was, hey, if you've got a blazing positive ovulation test when you shouldn't be ovulating, take a pregnancy test because HCG can confuse an LH strip.
Ah,
Yeah.
okay.
So I took one
And so when
positive.
it,
But I was
okay.
like, so for 5 seconds I was excited, but then I was like, this doesn't make sense. I just had a period. And then I was like hopeful because some women are like, I still got periods, but I was pregnant. My mom was one of those people who said that. So I was like, maybe, okay, maybe everything's fine. So went in for blood work. I
Mhm.
was definitely clinically pregnant. I think my HCG was like 400, something like that. You repeat it in 48 hours to see if it's doubling. And 48 hours later, it had gone up,
Mm.
but it did not double. It went to like 500. And so my doctor was like,
Can
all right,
you really quick back
yeah,
up for people listening? They're like ACG, all these acronyms.
yep.
What is that?
Sorry. Yeah. HCG, it
Okay.
stands for like human chorionic gonadotropin, but it's the pregnancy hormone. If you have HCG over 20 in your blood, you are clinically pregnant.
Mm,
Um,
mm.
so yeah, so like, and by the way, and there's so many like things we could talk about, but like when you take a pregnancy test, like a pee on the stick, it
Yeah.
fluctuates. The amount fluctuates in your urine. So like you'll see these women on Instagram who like
Oh.
virally test with test strips and freak out when it's like not as dark as it was and they think they're having a miscarriage.
Mm.
And I just try to tell women, I'm like, once you clinically see that on the stick, just go get the blood work. Like that is the way to
Yeah.
know. Don't torture yourself with like it can
Yeah.
change concentration in your urine all day where it's not going to change concentration in your blood. Um, at least not throughout the day, other than maybe going up, right?
Yeah. Yeah. Yeah.
So yeah, I blood test comes back positive. In a healthy pregnancy, you really want to see that HCG doubling every 48 to 72 hours max.
Oh, wow.
And so when mine didn't double, it didn't even come close to doubling. Uh, my doctor was like, "Hey, either." But it had gone up. So he was like, I'm tempted to not say that like that was a miscarriage. He's like, I'm wondering if this is an ectopic, like that had already happened. He's like, it might be
Mm.
ectopic, it might be whatever. So he really wanted me to take the methotrexate shot, which is a
What is that?
it's basically like the clinical abortion. This was before the laws had changed. And so
Mm.
it'll stop a heartbeat if there is still one. But when they did an ultrasound and they couldn't see anything in my uterus, right? So that becomes a pregnancy of an
Oh,
unknown
dangerous.
location. Yeah. So
Yeah.
so he was like, it's potentially ectopic, and I'd rather you not get to the point where like where we've confirmed this, and your tube, your fallopian tube, is at risk, right? Because the risk you run with an ectopic is that it bursts and you lose that tube, potentially your life. You just don't know.
Yeah.
So he
What's
really
for
wanted
people
to,
listening? What's an ectopic pregnancy? I know what it is, but like for
yeah.
people listening.
Yeah, an ectopic pregnancy is actually a pregnancy that is anywhere but the uterus. And there's a special one that can be in your C-section scar in the uterus that is still considered
Holy
ectopic.
wow.
Yeah, so but they're most commonly in the fallopian tubes, in the tubes
Yeah.
between your ovaries and uterus. So and an ectopic pregnancy is like never viable.
And
So
it's really dangerous for the mother because let's say, egg has made it through the ovaries and then starts to travel down to fallopian tubes. Sperm meets it there, they hit it off, make a baby. If it stays there and it starts to grow and it grows really rapidly, each day
mhm.
is like doubling, if not
Yep.
more.
Yep.
If it starts to grow there, it could blow up your fallopian tube, and that's
Yeah.
incredibly dangerous and sometimes life-threatening for mom.
Yeah, and it starts to eliminate half your chances of having a baby, right? Because
Yeah,
you alternate tubes each month, and so if you lose a tube, now you're only ovulating every other month. Um,
yeah, yeah.
so yeah, it's definitely not good. However, the methotrexate shot is a chemotherapy drug that's really basically you have to once if you have to take it for something like this, then you need to wait at least 2 or 3 months, I think, before you can try to conceive again, because it's very strongly linked with like brain deformities, if you can
Mm,
see after having recently taken it.
I
So
see. Wow.
yeah, which, and we'll get into this in a minute, but like something also important to know, the things that happen to your eggs like 6 months from now, anything you're doing today is probably not going to affect the 6 or 8 month from now eggs. The 4 months leading up to ovulation or an egg retrieval for anyone doing IVF, everything you're doing heavily affects the quality of those eggs.
Yeah, yeah,
So,
yeah.
so yeah, so when you have to do things like the methotrexate, that's going to heavily affect eggs for the next 3 months, right? Because
Wow.
they're in that window.
Yeah.
And I didn't really want, I was like, well, even if this isn't viable, I really don't want to do that. That doesn't sound pleasant. So I begged him to just keep repeating the blood tests for like a few more days because I was pretty confident that I was like, I had that period. I really think that was the loss. It's uncommon, but it's possible that your HCG keeps going up even if you've already like lost the pregnancy. So
Mm,
luckily the next blood draw, it literally stayed the same. And then the next blood draw, it had started going down.
mm.
So we called that one a miscarriage. And it's um, a chemical pregnancy is a pregnancy that's confirmed by blood work, but lost before anything's visualized in an ultrasound, before you can like
Yeah.
see evidence of the pregnancy. So that was called a
So
chemical pregnancy.
I've had that before. I
Okay.
after losing our uh, pregnancy at second trimester in 2020. I want to say it was 2021 that I was chemically pregnant. The pregnancy test said pregnant. Went into the doctor. The blood test said pregnant. Then they
Yep.
said come back in. And then when I came back in, the pregnancy test said negative. So they were like, basically, you were chemically pregnant, but there's nothing there. And now we have a negative test.
Yeah. Yeah.
Or not negative test, but it wasn't a negative test. What is it? The hormones weren't high enough or something, or the hormones weren't
Yeah.
viable to say that I was pregnant. If that makes sense. Like when you go
Yeah.
into the doctor and you get a blood test, it's not the same as doing a P test where they tell you if you're pregnant or not, right? So like
Yeah.
I did the P test at home, then I went into the doctor, did the P test. Yes, you're pregnant. Then they did the blood work and then checked my hormones to tell me, oh,
Mm.
actually, we think it was a chemical pregnancy because it wasn't blah blah blah.
Yeah.
If
You
I
might
remember
have,
that correctly.
it could have been one of two things. 0 to 20 indicates that you did have HCG in your system, but you're no longer clinically pregnant. So it might have been like 18 or something like that. So they're like,
Ah,
well, we don't really call
yeah.
this pregnant, but or it was like some number, but based on how far along you should have been, they can tell this isn't high enough, right? Like if you're
I
6 weeks pregnant
see.
and your HCG is 100, they can generally kind of tell like, okay, that doesn't line
And what
up.
does that technically mean? Does it mean like it didn't keep growing?
Yeah. So most pregnancies that end, most miscarriages are due to a chromosomal abnormality. which could mean that it can mean any kind of things, but it usually means that there's like three of one type of gene, like a trisomy. And there are three really common trisomies. The only one that's compatible with life is Down syndrome, trisomy 21. Then
Mm,
there's Edwards and Patau. I don't remember which one they are, but they can progress on, but the baby usually won't live beyond a year, like a year,
mm.
and
Wow,
without
that's
like
wild.
lots of intervention and lots of pain and things like that. So, and
Wow.
then the other ones won't make like the embryo won't even develop at all. If you get like a trisomy 2 or something, it just doesn't
Yeah,
develop.
yeah, yeah,
So
yeah.
that's the most common reason that people have losses. So the way our story went, I started tracking I took a few pregnancy tests just to try to see like when the line was going away. And it had mostly gone away. And then I decided, I don't really know where I'm at in my cycle. I'm just going to take one more to
Oh
make sure.
yeah,
Got a blazing positive. And remember what I told you about those urine tests? I was like, well, I should get a blood test. Like, it shouldn't be this dark if it was fading, but you never know.
yeah.
But the
And this
blood
is a
test,
pregnancy test, not an ovulation test now.
yeah, yeah. Um,
Wild.
so is the
Okay.
so I hadn't even had a period, right? Like I lost the pregnancy. I'm tracking it to nothing, and then I do the blood test, and it's like 500 something again. So he's like, "Yep, this is a new pregnancy. Let's see if it's doubling.
How
It doesn't."
long? How long between the how long between what you thought was a period that might have been the actual miscarriage to now you get this positive pregnancy test with the doctor?
Basically, like 28 days, like a cycle. So basically,
Wow.
yeah. So you can ovulate like right after your miscarriage, basically. Um,
Okay.
yeah. So I back to
Wow.
back pregnancies, but same thing, doesn't double appropriately, but it goes down on its own. So, and again, by the way, my OB's like, this is bad luck. It happens. It's
Mm.
normal. Come see me, and if like doesn't advocate for any testing. Doesn't
Wow.
Yeah, doesn't suggest get a RPL panel, get a reproductive endocrinologist involved. Nothing. Just hey,
What are all those things? What's an RPF? What is that?
yeah. RPL stands for recurrent pregnancy loss. They used to make you get three. You used to have three miscarriages in a row before they would test you. They've changed that to two. If you've gotten two consecutive miscarriages, you can now get
Yes.
recurrent pregnancy loss panel, and I'll tell you what's in that.
Yes,
Um,
please.
a reproductive endocrinologist is basically a fertility doctor. If someone's seeing a fertility doctor, they're seeing a reproductive endocrinologist, usually someone who
Okay.
assists with helping you get pregnant, right? Like,
Got
it's
it.
also really important to understand what these doctors do. OBs treat general women's health, and they are trained to treat a normal pregnancy. That is it. Like, any high risk pregnancies, you're probably seeing something called an MFM, which is a maternal fetal medicine specialist. If you have a heart issue, you're seeing a cardiologist. If you have a blood issue, you might be seeing a rheumatologist, like all these other things. But so it's important to know. And as we get older, our bodies just don't function as well. So trying to get pregnant,
Mm.
you're probably going to be seeing some of these other folks. So I hope not. I hope it does. Not everyone needs them, but it's pretty common.
Yeah.
So
Yeah, 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 yeah.
also don't feel like you're broken or weird. It's very, very normal as we get older
Yeah.
to need some help. So
Well, and here's the deal too. Like, we aren't just our uteruses. There's so
yeah,
many more parts to our body that affect how our body functions. So, like, your nervous system's part of it, your blood system is part of it, your skeletal system's part of it, your respiratory system is part of it. Your like, there's so many pieces, and each of those, and not fortunately, unfortunately, but each of them have a different doctor, right? So let me make sure I got
yeah,
the different doctors right. There is the OB that is normal or general women's health plus a normal pregnancy. Then
yep,
there is like, give me the names of all the doctors again.
yeah. Then there's a reproductive endocrinologist,
Yep,
which is a fertility doctor specialized in helping you get pregnant.
got it.
Then there is a maternal fetal medicine specialist, which specializes in high risk pregnancies when you need extra monitoring in your pregnancy.
And
You would
I heard that's anything over 35, or if you have some sort of like, I don't know. What, like who is that? Is that
it
just
de-
anybody over 35? Is there more people?
that's a great question. Anyone over 35, it is called a geriatric pregnancy, and they do consider you high risk. Now,
Yep.
most people, if you're just over 35, no other risk factors, they will not send you to MFM. Well, or what they might do is halfway through your pregnancy at 20 weeks, you generally get something called an anatomy scan where they check the baby's whole body. They're checking to make sure they have four chambers in their heart, the brain is developing,
Mm,
have four limbs, they don't have a cleft palate. They're just checking to like the normal structures. They're looking for all the
yeah,
organs, things like that. And it's very common. Everyone in pregnancy would get an anatomy scan. Um, if you're over 35, they might send you to MFM for that. Other people, their regular OB might do it, right?
I see.
So you might, it really just depends. But I would say for someone like you who potentially will be having an IVF pregnancy, has had a second trimester loss, and is over 35, you will most certainly, I would think, be seen by an MFM a few times throughout your pregnancies.
I see. I see. Got it. Got it.
Yeah.
Okay. Okay. Good to
Um,
know.
yeah. So then we took a break. I was like, okay, no more pregnancies. I can't keep doing this back to back thing. We don't know what's going on. I refused to believe that I was frustrated that my OB wasn't suggesting I do anything. Mind you, I start reading, I'm starting to talk to women, I'm joining these groups on Facebook. You hear a lot of conflicting evidence in this
Mm,
area of medicine specifically. And there's actually a quote in one of these books that I love where he's like, you expect doctors to be at the forefront of medical knowledge, and they're often
yeah.
way behind because of the bureaucratic nature. Like, until something becomes
Yes.
so public and so studied and so mainstream, they can't promote it or they can't make treatment decisions like based off of it. So when you have like uncommon things like being 1 in 100 and, you know, you sometimes have to go outside of the box, right? And I can't tell you how many times, I asked my OB, we'll explain why in a second, but I asked my OB for a blood thinner, and he was like, absolutely not. Let me refer you to this reproductive, RPL, recurrent pregnancy loss specialist. So I went to see that guy. He said, no, sorry. Let me send you to the MFM. And I go to the MFM and I walk in and tell him something that I have. And he's like, yeah, you needed to be on a blood thinner yesterday. Like, let me write you
Oh
that
my
script right
God.
now. And
Oh
it's
my
like,
God. You got to be kidding me.
so anyway, but yeah, so we took a break. We went to see our fertility doctor, and she said, hey, with your age and what's going on, it suggests an embryo quality. So either your eggs are bad, or your husband had a normal sperm analysis. So it probably
Mm-hmm.
means like your eggs are poor quality, which wouldn't be uncommon for people your age. Because the first
Fair.
way that the first way that they will test your egg reserve, which is not the egg quality, it's how many eggs you have left, is they test something called your AMH, your anti-Müllerian hormone.
Oh,
And
yes. Okay.
yeah, and you can see there's like a number, if you're this age, this to this is a good amount, right? So like, and I'm going to generalize here, but if you're under 25 and you get a result less than one, that's considered something called DOR, diminished ovarian reserve. And it means you have less eggs than you should at your age. I had a very
Mm,
I had a very high AMH, so they were like, whenever I first did my general testing, they were like, "Oh yeah, like you have the eggs of a 27-year-old. Like that's great.
right.
Go forth."
Okay.
And so she's like, "But even though your AMH is high, you have a lot of eggs left. It's seemingly like maybe they're not good because you're having these
Mm,
losses." So she's like, "The fastest way to a baby would be IVF because then we could get your eggs, your husband's sperm, and test the embryos."
yeah.
And
Yeah.
she's
Yeah.
like,
Yeah. Yeah. Yeah.
and look, if we get 15 eggs, 10 of them fertilize, 9 of them become embryos, and only one of them is viable, PGTA, tested, we'll know that that's true. Your eggs probably were
Yeah.
problematic. She's like,
And
if
that might
we,
have been the problem.
she's like, but if we get, 15 eggs, 10 of them fertilize, 10 of them become embryos, and 8 of them are normal, then we actually know there's something else going on. And before we do transfers, we'll do more testing.
Mm.
And all of that was really sound advice, but I didn't really like this woman's bedside manner at all. I do feel like
We need to have a whole conversation about bedside manner because, ma'am, anyway, keep
yeah,
going.
I felt just like a number. And anyway, and I also felt like, anyway. So point being is, I think we were going to use her, so, but she was like, in this appointment, I've taken 2 months, from the miscarriages, and she's like, the first thing I need to do is like not get pregnant. We need to start cycle day one and go from there. And I was like, well, I wasn't preventing this particular cycle, so I'll let you know. Lo and behold, I get pregnant that cycle. It's October of 2021, and for the very first time, my two things. For the very first time, my numbers are doubling the way they're supposed to. My OB's like, hey, congratulations. This is what we want it to look like. He also tested my progesterone. Progesterone is a normal hormone that all women have, pregnant or not. Your body's progesterone fluctuates depending on where you are in your cycle, right? Um, and it gets elevated after you ovulate. And if you are pregnant, it stays elevated. But there are like minimum levels it has to be at to support pregnancy. And if it drops below that, it'll signal to your body to shed the uterine lining and the pregnancy with it. So
Wow.
yeah, and so a lot of times if you're having pregnancy loss, one of the things that could be happening is you don't make enough progesterone on your own. I want to say when he tested mine for the first time, it was at 11. Now, if you
What is it supposed to be at?
if you Google first trimester progesterone, they want it between 9 and 45, but most reproductive endocrinologists don't want it below 25. So my doctor, my OB, again, not trained to help uncommon pregnancies, says it's fine, perfect, it's in normal range, clinically great. But he's like, but if you want, I can prescribe you progesterone to take just as a precaution. So I say yes. He prescribes it, taking it once a day orally. The
Well, what
only
are you taking and
test,
how much are you taking? Because I currently take progesterone for a different reason. I'm more so trying to balance my hormones to ward off the symptoms of endometriosis. And
okay,
I've tried different types of progesterone and different doses,
yeah,
and like some have worked, some have not. When I was in the US, oh my God, I anyway, that was a hot mess. But like they didn't think about like, oh, let's try and test her and then rebalance them. They just like, well, let's just give you a stronger dose. Let's just give you a stronger dose. Let's just get I was taking 15 milligrams of northindrone, I think it's the type of progesterone,
okay.
once a day.
Oh my,
Still miserable, inflamed like crazy, basically bleeding for months at a time, just like so much pain all the time, just like miserable.
and
Gained
did they
so
have
much
you taking
weight
it orally?
orally.
Okay,
Now, when I moved to Dubai and got with my current fertility specialist, shout out to Art Fertility Center. They are the bomb. If you are ever like, huh, I'm going to come to somewhere else really great and do a couple of cycles, Art is where you should do it. um they saw my labs and saw me, and they were like, this is terrible, you're going to be miserable, we need to switch this up. They switched me to Dufaston, and I take it every 8 hours. So instead of one big dose once a day and then your body goes and figures it out, it's every 8 hours, 6 a.m., 2 p.m., 10 p.m., 6 a.m., 2 p.m., 10 p.m., around the clock.
amazing.
Girl, I lost 10 pounds. My inflammation went down. Oh my God, completely changed the game. Anyway, what
Yeah,
type of
that's amazing.
progesterone and how did you take it?
Yeah, so I want to say it's like like not generic is called Prometrium, and it was 200 milligrams, and I was taking it once a day orally. However, there have only been two large scale studies. Here's another thing, another tidbit for anyone watching. If you are looking at studies to try to understand something about yourself, you've gotten a diagnosis of some kind, whether it's endometriosis, you've been told you have a genetic factor that's contributing, and you go to look for like the evidence of what people have done to overcome this, a few things you can do when you look at the studies, like the sample size should be large, right? They should have tried to control for as many variables as
Which that's
possible.
hard because that's half the battle, because not a lot of these like things are large studies. You can't find large studies on like
Exactly.
women's health, which is tough.
Exactly. But there were two studies done where they basically tested the theory that progesterone could help save a threatened pregnancy. And
Mm,
and most OBs are going to tell you if your pregnancy's in trouble, progesterone's not going to save it. And that's not true. What they mean is that the majority of pregnancies are lost because of a chromosomal abnormality, and progesterone's not going to save that. That's true. And
Mm,
sometimes your body will lower its progesterone because it knows that this isn't a viable pregnancy and it's wanting to shed it. All of
yeah.
that's true. I get it. But you could have a genetically normal baby in there and you just aren't making enough progesterone, and progesterone will save that pregnancy. And I
Mm,
can't remember, like one was called like the Promise and one was called the Prism. I'd have to go back and look, but the studies that do study it that showed that it can save threatened pregnancies, the method for testing was vaginal insertion. It's the same pill, like the same pill you would get, but you put it like a suppository up
vaginally as
there,
opposed to orally.
and it's right there near the organs that need it, and so that
Mm,
helps a lot better.
mm,
So like, and these are just such little things. Like I'm in all these like miscarriage groups on Facebook, and like little things, like I'm like, hey, if they prescribed it to you, just start like call them and ask them this. Don't take my word over your doctor, but read these two studies, call them and ask if they care if you take it. Because most of them are like, I don't care, do what you want, right? Like
yeah,
they, a
yeah,
lot of
yeah,
them aren't
yeah.
even supporting the progesterone anyway. So if you're like, can I take it vaginally versus orally? They're like, sure, go for it. Um,
Mm,
and like these little things might make a difference, right? So,
interesting.
so he prescribes me the progesterone. I take it orally. Um, and for the first time, I go in at 6 weeks. We see an intrauterine pregnancy. Um, we see, you know, a sac. We see a little embryo, and we see a heartbeat. And my doctor is like, "Hey, I think we're like out of the woods. We think this is the baby you're bringing home." I was due on my birthday, June 24th.
Wow.
Yeah, and I'm like, "Okay, we did it," because he was like, seeing having a miscarriage after seeing a heartbeat's like less than 10%, right?
Mm,
Um, and then like a week later, I start spotting, and
mm.
and we go in, and the ultrasound there still shows a heartbeat. You know, still seems okay. And I do have something called an SCH, which is a subchorionic hematoma. It's a
That's what I
little.
had.
Is that what you had?
That's what
Okay.
I had. So I had that at my, so I had that. So at 7 weeks, I started spotting, came for maybe a week or two, then went away, then came back. And what we found is as the baby was growing, a subchorionic hematoma was also growing and almost like both
Oh.
taking nutrients from the placenta. And so,
Yep.
like, I'm sitting there drained as crap because I'm not only feeding baby, but I'm also feeding the subchorionic hematoma. And the problem that I actually had, which then we think resulted in my pregnancy loss, is the hematoma started to shed. So I started dropping these clots, and then my body
Hmm.
would want to release it. And then I would start these clots and like they were small and they got bigger and bigger and bigger. They eventually got to like lemon size.
Oh
And
my
I
God.
was, yeah, girl. And I eventually got to like lemon size. And what was happening is because they were so big, the the cervix is opening to do that. And that's
Yeah.
supposed to
So
be
let
like
it go.
a yeah, that's
And
supposed
it's
to
supposed to
be
be
a
closed for business while you're
thank
pregnant.
you. Because, and so eventually it got so big that my water broke. And so they were like, all right, at this point, and like, I would go into scans and like baby's like kicking this thing, like as if he's having like a little time in there, like kicking, oh, this is a little football. Let me like, and you see baby in there like pushing against it.
Yeah.
And so eventually uh it had they had gotten so big, like the subchorionic hematoma had gotten so big and was shedding so much that it like the cervix was just like, okay, water broke. And then because it was opening so much, that's supposed to be like a, what's the word, we're supposed to be super not fertile, clean in there. What's the word?
Oh,
What's the word?
sterile.
We're
Sterile
supposed to be sterile.
environment.
Thank you. It's supposed to
Yeah.
be a completely sterile environment, but it kept on opening. And so then, you know, baby's
Yep.
heartbeat stopped. It now gets like infected because it's like it keeps bacteria keeps getting. So they were like, oh my gosh, we've got to get this.
Yeah.
She's got to deliver like now.
Yeah, yeah. Oh my God.
Yeah.
I'm so sorry, by the way. Let's pause for a second, actually. I want to talk about, so your son's name was Max, right?
Yes.
2020. You delivered him at 17 weeks. Is that right?
17 weeks. 17 weeks almost exactly.
Okay. And I want to ask just like a few questions. were you only being seen by an OB for that pregnancy, or were you being seen by an MFM because of the SCH?
Yeah, great question. So I was being seen by, let me see if I can remember. I had my OB. I did have a, I guess I don't remember how you would say her, but there was a specialist because I was like older and I had endometriosis.
Oh, yeah. Okay.
Um, so both of those were involved. And then there was because I kept on having the chat like the spotting and the pain, there were like a handful of specialists that I would like go see.
Mm-hmm.
But it was like it was UCSF
Mm-hmm.
and their system. And they're a research institution, and probably, by studies and by awards, are like the best, even above Stanford in the Bay Area. But their bedside manners were just not great. And it's a research institution. So like it wasn't it it was by chance that my OB, who would have been my midwife, I guess, was like, I am gonna hold your hand and I'm gonna be part of this with you and like stay close. It was very like everything separate and everything is I don't know how to explain it, but it just
Yeah.
wasn't very didn't feel like I had my team that was walking
Yeah.
with me on this journey. It felt
Yeah.
very, I'm gonna see a bunch of specialists. They're gonna talk to me as if I'm a doctor just like them, and I'm supposed to go figure it out.
Yep. Yeah. And because this is a research institution, they see lots and lots and lots of people. Like it's a numbers game for them, and you're like a number
Yeah,
system, right?
totally.
So, um, were you ever on bed rest or pelvic rest?
Neither.
Neither. Okay. Um, did you ever get NIPT testing done? It stands for non-invasive prenatal testing. It's a blood test. So back when our parents were pregnant, the only way to check for any kind of like genetic abnormality would have been an amniocentesis or a CVS, chronic chorionic villi sampling. Both
What
of
is
those
that?
are,
Is that where the needle?
yeah, one of them goes into the sac and takes a little bit of amniotic fluid, and one of
Yeah.
them takes something else, but both of those are come with a very slight risk of miscarriage because they're invasive tests. Now they can literally take the mother's blood and spin it, and as long as it's done after the baby has to be like 9 or 10 weeks along, and then there's
Hmm.
enough of baby's blood in your blood that they can usually separate that out and analyze. And what they're usually looking for is the sex gene, because a lot of people want to know these days.
Yep, yep.
And they're looking for those three most common trisomies, Edwards, Patau, and Down syndrome, to give you an idea.
Mm.
Did
I
you
do
guys
I
have?
do believe we did that because we did get the sex, and we did do the extra test to be able to find those things out. And I think everything came back normal.
Okay. And then, um, and maybe we don't. You'll have to tell me if you don't want to answer these, because I know these are obviously like invasive questions. I feel like you said on one of your other lives the other day you had had some failed transfers. Is that right?
So I've never done a
You've
transfer
never done a
yet.
transfer. Okay.
I've
Okay.
done, I've never done a transfer yet. I've done 7 rounds of IVF, but not all of them have come back with an egg that could be
Okay.
fertilized.
Okay. And you did some medicated cycles, right? Like Clomid or stuff like
So
that.
even before, yeah, so even before we did IVF when we got here, when we were still in the US, we did medicated cycles actually for a really long time. We did Clomid. It was the other kind of Clomid. Begins with an L.
Letrozole.
Letrozole.
Yeah.
We did letrozole, I want to say for a good 6 months. Then we did 2 cycles of IUI, failed. They then realized, oh crap, just kidding, your fallopian tubes are closed. So then I had the histopingogram, when they
The
go in and they like,
HSG where they inject
yeah, where
dye.
they like, yeah. Well, they did that and they realized, yeah, they're definitely closed. Then I did a fallopian recolonization where
Oh,
essentially it's
were
like we
they?
go in and retunnel
Yep.
through. That only lasts. The problem with that is that like this pissed me off actually because my doctors weren't all on the same page.
Hmm.
I
Hmm.
kept on saying, should we wait until I am prepared for a cycle to do that surgery? Because I have endometriosis.
Hmm.
inflammation. This thing, as soon as the cycle comes, I can get scar tissue and that thing will be blocked up in a second. Like, no, 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 just schedule it for when the doctor's available. Okay, we schedule it for when the doctor's available. I wake up from anesthesia. My sweet doctor who did the fallopian recolonization, so, so sweet, was also pregnant doing the
Oh, yeah.
recolonization. I'm like, bless you. She's like, I'm believing for you. This is going to be great. Gave me her phone number. She's like, text me anytime.
Oh,
But she's like, you realize now that like you should go home and try
yeah.
because you're wide open. It's a perfect time. I was like, I just ovulated before this. So no, I can't. I'm gonna have to go through a cycle, have a period, and then it'll be next cycle that we try. She's like, oh, but you know what? Still believing for it. Like what can she do,
Yep.
right? Like,
Yep.
but like I
Well,
look back and I'm like, oh, I just wish anyway. I mean,
here's one of
everything
the
will happen
most
as supposed to, but
infuriating things that people out there should know if you're ever going to have to go through any of this stuff. It's always like that. There was no way to do it any differently because think about this. If you had already ovulated, or not if you'd already ovulated, but like if they did it before, there's like this chance you could be pregnant. Like if they try to do that
mm,
procedure after a period but before you ovulate, in theory, like in the medical community, they're like, in theory, there could be a fertilized egg in there somewhere. And so it's like,
yeah.
anyway, so it's really,
Dangerous to
so you
do that.
always, yes, you always have to do it like at the end. Like there's all these timing for these procedures that they have to follow based on the red tape. And it's
Yeah.
really frustrating for us, especially, but probably them too, probably your doctors.
Yeah.
But
Oh,
anyway,
we're saying all these terms and I should probably clarify what these are. So I said a histopingogram. A histopingogram is an ink dye test. Essentially, what the doctors do is they push dye through your uterus and they push it all the way through, and they track to see if they can see the dye make a path in both fallopian tubes to be sure that you don't have any blockages in your fallopian tubes. And it's like you can see it all the way.
can I put a
The other
picture on
thing,
the screen? I can
yes,
show them what
please, please
I can
do.
show her what it looks like, but how do I do that?
Yes. I think there's like a little share button.
Is it, how do I,
Let me
huh?
see.
Uh,
Yeah. Like you have
oops.
the little
No.
three dots, and then you
Oh,
can hit share.
share to. Well, it's all right. I'll I'll come back and add it as like a comment to this when we save it.
Yeah, yeah, yeah.
It's just like you can see the dye shooting out, and it's like you can tell immediately, and it is, by
Exactly.
the way, wildly painful.
It
I
is
was
so
not
painful.
prepared for how painful that
Oh my
test
God, it is so.
was.
The lady was like, "Oh, just take some Advil before you come." I'm like, "Bitch, have you had this before?" Because I needed more than just Advil. It was
No,
so painful.
yeah,
So then when I did
go ahead.
mine, they realized, oh my God, my tubes were not clear and that they were blocked. And then I had a fallopian tube recolonization, which is exactly what it sounds like. Essentially, they go through and they tunnel through your fallopian tubes to make a new hole or a pathway so that in your next cycle an egg can travel through it and meets the make it to the uterus. Um, Wild story though, by the way. They give you like, at least for my recolonization, they give you like it's not a full anesthesia, it's like a semi anesthesia, I guess, to make you go to sleep. Girl, I woke up in mine
Oh
and
my
I remember
god.
being like, no,
Oh,
no, no, I'm awake. I can feel this. More medication, more like I was like conscious enough to tell them, no, I'm awake. I can feel this. More medication.
that's so
Like,
terrifying. Oh, you
oh
poor
my God,
thing.
so crazy. So scary. I don't know. I
Oh,
can't see your video, by the way.
oh, you can't?
Mm-mm.
I see myself. At one point, I accidentally turned my camera off, so like it's off now. And then if I turn it on, you still can't see it.
No,
Can anyone else see it? Like anyone who else is still out there? Can you guys see my face?
I know. I can see. Oh, there's so many people on here. Hey friends, can y'all see her? I can't see her. I can hear you fine.
Yeah,
Can you see me?
yeah, I can see you, and I can see
So
myself.
weird. I want to see your face. Why can't I see you?
Oh. Uh-oh, we might have to stop and start over. How do we?
Oh, that's so whack though.
Or wait, can maybe I'll leave and you have me rejoin?
Oh yeah, I can still, yeah, yeah, maybe rejoin. Let me do
I'll leave.
this. Yeah.
I'll leave and then you.
Somebody else said that, yeah, you leave and then I'll send it to you again.
Okay.
It says that you're still, yeah, she sees a gray screen. Let's try. There we go.
Okay. Can you see me now?
Now you're back.
Okay. All right.
And so is Hope.
Um, man, wild times.
Isn't that
So
crazy?
yeah,
Like
that's so crazy. Um,
nuts.
okay, so a couple things just before we move on. This is so hard, but just I share these things, by the way, first of all, for any woman, you, me, like there are things I've learned that if I could go back, like you do the best you have with what you have at the time.
Yeah, of
But I
course.
share these things so that if it happens to you again, you know what to do, advocate for, and ask for. So what's wild to
Mm-mm.
me, an SCH, a subchorionic hematoma, what I've had with several of my pregnancies, what you had with Max, is very common, especially in, first of all, it's extremely common in IVF pregnancies. And it's common the older you get. And it's generally not super threatening. Like it generally
Mm,
will resolve and go away on its own.
mm.
However, like the second my doctors see one, I have to go on pelvic rest. Pelvic rest is different than bed rest. It
Okay.
means I can't ride my horses. You really shouldn't be exercising, no sex, like anything that moves the pelvis. Like you can go to work, you sit in your chair, you can do whatever, but you should not be doing anything that affects your pelvis. And then if it's growing at each scan, in theory, you should probably go on bed rest for an SCH. Like
So what's growing? The
the
subchorionic
subchorionic
hematoma.
hematoma. Yeah,
Oh
if
wow.
it's growing like that and threatening the pregnancy, putting you on bed rest, first pelvic rest is would be the first thing, and that's usually enough. Then bed rest, that can keep it from threatening the pregnancy, right? And so what happened was no one ever told you to stop doing things, and so
No.
that and maybe it might not have changed anything, or it might have, like it would have been nice if
Yeah,
they'd done
yeah,
something, and so
yeah.
yours ended up threatening your pregnancy, and that like losing a genetically normal baby is extraordinarily uncommon. Like we talked about that 1 in 100, we're talking like 1 in 10,000. You should not be losing a genetically normal pregnancy, and you should not be like and you shouldn't be miscarrying genetically normal embryos either. Which you may
Yeah.
see that may be happening when you go through IVF. I hope not, but um, it's important to know that because then you can kind of like there are things you can do if it's happening,
I
right?
did not know that. I didn't know
Yeah,
that because he was fine. His heartbeat
yeah,
was fine. Like I was checked into the hospital, what, Halloween we got there, and then the fourth is when we left. And for the first few days, he was fine. Heartbeat was fine.
yep,
He's kicking around. He's kicking that hematoma, no big deal. But
yeah.
like no one was like, "Oh, you need to do this. You need to do this." And I remember going on one of my scans, they wheeled me over to one of my scans. I guess that was technically pelvic rest or maybe bed rest. I'm not sure. But they wheeled me over to one of my scans, and I remember the I don't know what you call this, those people, the people that do the scans. There's a special word for it.
Um, the ultrasound tech.
Yes. The ultrasound tech asked me, "Oh, have they asked you to put on a cap yet or a cup or something?"
Oh, probably they asked about a cervical cerclage. It's something that goes in your cervix when you have a threatened pregnancy, something is pushing on your cervix. There's a cervical cerclage that they can put in there to help prevent that from opening and losing the baby, basically.
I was like, no one has mentioned this to me whatsoever. This is all brand new news. So when
Yeah.
I go back to my hospital room and I'm like, hey, the tech mentioned something like I didn't know the name of it, but I said a cup,
Yeah.
some sort
It
of
is.
cup. They're like, oh, no, you won't be needing that. Or, they just kind of dismissed it. It was like, no big deal.
Yeah. Yeah. And it wouldn't it be nice to know all your options? Like, and we
Yeah.
don't know, like, these are the people you're trusting to be the
To know.
experts. So you think
Yeah.
instead I'd like to be like, now we know to be like, well, why isn't it needed? When would that be needed?
Yeah.
What does that
Yeah.
thing do? Tell me why you
Yeah.
think specifically I don't need it. So you're
Yeah.
sure that I'm going to be okay without it? Like, and you have to
Yeah.
really start. hammering those things. So, um, all right, cool. Well, so that's super helpful to know. I thought, obviously we talked a little bit about Max, but I didn't know. So yeah, no, knowing he was genetically normal, knowing that that had a lot to do with it. Now too, because it's so common in IVF pregnancies, when and if you have one again, first of all, try not to panic like, oh, it's happening again. They are very, very, very common. Um, but
Mm,
but whoever is doing your monitoring, like your ultrasounds, you know how like when they measure the baby three different
yeah,
ways and look for the
yeah,
average, they measure
yeah.
the sac, they measure your ovaries, they measure your uterus. They should be measuring that subchorionic hematoma every time. And you should write down the
Mm,
measurements. And if it's growing, then the question is, should I be on pelvic rest? Should I be on bed rest? What are we doing to mitigate this? Right?
yeah, yeah,
If that
yeah,
ever
yeah,
happens
yeah.
again. Um,
Yeah, good to know. Good to
yeah,
know.
yeah. But
Good to know.
so with that pregnancy that we thought was viable, I started spotting, still had a heartbeat. They said come back, in a week, basically. Um, Meanwhile, by the way, we had done that one progesterone draw. It was 11. I'm taking it orally. OB never tests it again, right? Super common. It's pretty common that OBs don't even test your progesterone. I wish
Mm,
that was standard. Like anytime a pregnancy test is called in, a progesterone test should be called in. Every time in the
mm,
pregnancy, for every pregnancy out there, we would, in my opinion, save a lot more pregnancies if we were doing that. Um, but he never tests it again. And I don't know because for this one, I passed. So I go back in at 8 weeks and it looks normal at first. Like I can see the sac, I can see the baby, but the screen is not flickering where the heartbeat should be. And
mm,
and the tech is like, hey, I'm sorry, there's no heartbeat anymore, which means like, you've now lost the pregnancy.
mm,
I took, the doctor said, here are the choices. You can wait to let your body figure this out on its own. I can give you some pills that will help dilate, your cervix so that you'll go ahead and pass this naturally called misoprostol. Or you can get a DNC, which stands for a dilation and curettage. And it's where you go under anesthesia, they go in, they basically kind of scrape out the inside of your uterus and everything with it. Um, and in there is a very, very, very marginal risk to that procedure, right? It's a surgical procedure, anything like anything else. So I opted for the misoprostol, which was the pills, because I wanted it to just, be over, right? You're in those moments and you're
mm,
like, I just want this to be done. Uh, it literally, it was super painful and super traumatic. Like you
mm.
feels like labor. I passed the baby on the toilet, like you see it, like I mean it was very, very, very small, but like, it was just honestly it was horrendous. So
Yeah.
and I don't have any evidence to this. It's just a gut intuition, but I believe that that baby was genetically normal, and I did not. I just didn't
Mm.
have the progesterone support to support it, or the other things that I'll tell you that I need in a second. Um, Same thing that happened with that very first loss. I'm waiting for a cycle to come back, and it never comes back. And I take a pregnancy test, and I'm pregnant again. And this time, by
Literally
the
back
way,
to back cycles.
yeah, yeah. Well, and here's the thing: anytime you have a miscarriage, you're extraordinarily fertile thereafter. Anytime you have a baby, you're
Ah,
extraordinarily potentially fertile thereafter. Like, so anytime you have that procedure you had, the recolonization, very fertile. Even just the HSG dye test, if you guys get that, you're very, very fertile after
I
because now
got,
you're
so that's what
wide
happened for
open.
us. I did my first time I did the HSG. Um, that's when we got pregnant with Max. Like right
Yeah.
after that.
Yep.
Yeah.
Yeah. So all of those things, like these things, like make you more fertile. Um, with that fourth pregnancy, blood work was going up. 6 weeks, saw a heartbeat. By 8 weeks, no heartbeat. And this
Wow.
time, yeah, this time I opted for the DNC because I had read, and again, by the way, nobody, well, actually, sorry, I'm missing a part of the story. But nobody had told me that he didn't tell me that if I had done the DNC on the one before, I could have genetically tested the baby. Like I could have done DNA testing to see if the baby
To
was genetically normal.
know.
Yeah. Didn't even
Oh,
didn't tell me that, didn't tell me it was an option. And by the way, after the first two losses, and this is actually the main reason I wanted to talk to you. After the first two losses, I flew to Costa Rica to meet with this other doctor. And he did some other testing, right? He tests all the normal stuff, my AMH, my vitamin D, my hormones, blah, 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 blah.
Hmm.
But he tests for something called MTHFR. Have you heard of this?
What's that? No.
It stands for methyl.
MTHFR.
Yeah. It, it, it doesn't matter what it stands for. It's a really long, stupid word. What it what it is though is it is a gene, a genetic basically defect. There are
Uh-huh.
two types. And this is going to stay with me on this, okay? There are two types. One is C677T and one is A1298C. Half the American population carries at least one of these genes.
Okay.
And it is problematic for everyone, and I'll explain why in a second. But where it gets really problematic is if you have two of the same kind, if you're homozygous for one or the other, or you're compound heterozygous, which means you have one of each. Okay?
Okay.
And if you have any of this, just one, two, one of each, and some other immunological factor like
Yes.
endometriosis, it will
Yes.
highly affect fertility outcomes. Um, Basically, it's an enzyme in your body that's crucial for converting folate into like 5-methylfolate. It also processes homocysteine, which is an amino acid that can create that affects inflammation and clotting issues, and it supports DNA methylation. Have you heard that word before, or that phrase, DNA methylation? So basically cell division, which is crucial to everything your body is doing, but
Yeah.
but especially in early embryo development, cell division is critical. Okay, so why this is important is people who have MTHFR, which could be half the population, don't process folic acid. Okay, back in the day, folate is found in vegetables like spinach, broccoli, a lot of like cruciferous vegetables. It's found in natural things. It's found in wheat. But when we started mass producing food like wheat, we were destroying some of the natural minerals like folate. And so we had to create folic acid, which is synthetic folate, and we had to fortify foods with it, okay, to make it healthy still, so that we were getting vital nutrients. But if you have MTHFR, you won't process folic acid. Folic acid will go to your folate receptors and just clog them. And it will raise your homocysteine, which means you start having clotting issues. And it will, um, yeah,
Wait, what's this acronym again? MT what?
MTHFR. It looks like, are we allowed to curse on these? It looks like
Yes.
mother effer, like then that a lot of people call it that gene.
Oh, the
Um,
mother effer gene. I like that
the
actually.
mother
The
effer
mother
gene.
effer gene.
Yeah.
Yes, I'm here for that.
So, um, this doctor tests me for that. Something else that's not irrelevant. Well, it's relevant, but like we don't need to dig into it as much because it's not as prevalent. Called Pi 4G 5G, um, also clotting related. So then I join. Oh, and by the way, I went to Costa Rica, so these test results are in Spanish, and I can't read
Uh,
them. And I have a really good friend on here. She's actually, it's funny. She's my sister's sister-in-law. But
oh,
when I was
nice.
going through all these miscarriages, my sister Morgan connected us. Her name's Amanda, and so that we could talk about what we were going through because she had just had a couple losses
Mm,
as well. And so she speaks fluent Spanish. She's married to someone of Latin descent. She studied abroad there, and so I told her about all of this, and I'm like, "Can I send you my test results and you tell me what this means because you speak Spanish?" She's like, "Yeah, I'll do my
yeah, yeah.
best." And so she said, you tested positive for the MTHFR variant and you're homozygous for like the worst one, which so very, very strongly related to blood
Wow.
clotting. And then she's like, but before you go to your doctor, I promise you your OB and maybe even your reproductive endocrinologist is going to say the tests do not confirm that this affects miscarriage because there hasn't been a lot of testing. But like the anecdotal evidence of like the thousands and thousands and thousands of women would suggest otherwise. And what the testing does prove is that if your homocysteine is raised, that absolutely affects miscarriage. The main
Mm,
reason that your homocysteine would be raised is because, well, there are some other reasons, but bear with me. The main reason I think it would be raised, not a doctor, is that you have this and you're eating folic acid left and right. And by the way, you know what's in most prenatal vitamins? Folic acid.
I take 400 mcg of it every day.
So, especially for women who have MTHFR and endometriosis, it can be a real, like a real complex match. And so when I saw you were taking all that folic acid, I was like, because you can take folate, it's like take methylated folate. It will be this exact same thing. But if you have, like, first of all, you don't necessarily have to go out and get tested for MTHFR. If you're interested, do that. But a safe way to just be careful is just take real folate instead of folic acid because it's the exact
Mm.
same thing. Now, you may go ask your OB or your RE, hey, can I take real methylfolate instead of folic acid? Your RE is probably going to say yes, but your OB will say the only studies that have shown to prevent neural tube defects in pregnancies is folic acid. But a scientist will tell you that folate and folic acid are the exact same thing. But when we studied it, they didn't have, like, folate wasn't made into regular vitamins yet. Folic acid was all you had to test. And so folic acid is what has been proved to prevent neural tube defects. But folate will do the same thing. And like if you look at a lot of the big common vitamin companies like Ritual or Thorn, I'm trying to think of some of the other like big, like really high quality ones where they tell you where they source everything that's in your vitamins. They're all
Mm.
using real methylfolate.
Good to
And
note.
considering half, so if you're having infertility, if you are going through IVF, half the people have MTHFR. If one thing you can do is take folate instead of folic acid, um, that could have a huge impact.
How can you find out if you have the motherfucker gene?
Yeah, you can ask your RE, your reproductive endocrinologist. You could ask your fertility team if they'll test you for that.
Mm-hmm.
Be prepared for them to say no. We don't want to test you for that. Here's the other thing too, by the way, for anyone listening. Hopefully, you've a good medical team might tell you, hey, I don't believe that that is going to contribute to your success or not, but if you want to, I'll test it. Right? Like finding
Mm.
people who will run tests. Like the one thing that my OB in Dallas did, even though he like really couldn't support these pregnancies and I needed these other doctors, one, he had no ego about working with all the other people I was working with.
Mm. That's great.
Two, anytime I said, I want you to start testing my progesterone every time. He's like, well, the reason we don't do that is because we don't believe that fixing your progesterone can save a threatened pregnancy and more tests cause patients anxiety. But if you are specifically asking me to, I will. I'm like, great, thanks.
Mm-hmm.
Um,
Mm-hmm.
I would come, like I was like, hey, when I would get pregnant, I'd be like, I want to come in twice a week for ultrasounds. He's like, that's fine. You tell me how often you want to come in. And his
Yeah.
front desk ladies would try to gatekeep. I would call and be like, hi, I just got a positive pregnancy test. They're like, great, we'll see you at 9 to 10 weeks. I'm like, no, 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 you don't understand. I've had several losses. Dr. Ruck sees me right away. They're like, no, no, no. I'm like, please give the doctor a note. Like,
Yeah.
they're just doing their
Yeah.
job. I get it. But like they
Yeah.
would try to say, no, we're not going to see you. And I'd be like, I'm going to see him later today. I promise you. Give him this note and
Yeah.
he's going to have me come in today. And he always did.
Exactly.
And he always did.
Yeah.
Right. So,
Yeah.
trying to find like care providers who will like at least like they might say, hey, I don't think this is going to affect you, but if you want to know, like we'll do this testing. So hopefully ask them if they'll
Yeah.
test you for it or ask your OB or ask a general practitioner, or worst case, you can order these types of tests for yourself. If you order them for yourself, though, you probably are paying out of pocket. Um, like insurance always covered mine because a doctor actually ran it. Um, but you can also just ask LabCorp, or Quest. You can order it yourself.
Yeah. My next questions for you are, you shared before a bunch of books where you learned a shit ton of this stuff, and you got to tell me what each of these books are and like
Yeah.
what you learned from each of them really quick. And then so like people aren't like, oh my God, this is all like doom and gloom. You actually just had a baby. So I would love to
I'm
like,
saying.
hear about your like journey and this stuff. So first let's talk about the books.
Yeah. So when I started talking to my friend Amanda and she told me about MTHFR, I don't have it here, but there is, and don't start with this one. This is just anecdotal. If you really want to go down the MTHFR rabbit hole, it's a book called Dirty Genes by Ben Lynch. It basically talks about some really common genes, one of them being MTHFR and the ways it can affect your life. Um, and that like so he's a geneticist, right? And a lot of people don't go this far into their health unless they're experiencing a problem, but it is very interesting. By reading this book for myself about my MTHFR, I learned about like another set of genes that can affect people having food allergies and inflammation. And I have a friend who's like struggled with this chronic stuff her whole life with no explanation. And I said, hey, I just sent her like the paragraph. I said, look into this if you're interested. Turns out it was true. It's like changed the way they address like her inflammation and her health. So anyway, that's one for that rabbit hole. But my friend Amanda told me it starts with the egg. She was like, people are going to tell you that you can't affect your egg quality or quantity. It's true, you can't affect your quantity. Like you can't.
But your
Um,
egg quality, you absolutely can. Like
you
mine completely
absolutely can.
changed in a matter of 30 days.
Yep, and that CoQ10 is life changing. That's probably
Game
having
changer.
the
Why does
biggest
nobody talk
effect.
about CoQ10?
Yeah,
Why does nobody talk about CoQ? I can't believe how many like I saw so many specialists in the US. No one had ever brought up CoQ10.
yeah.
Ever.
Nope,
How?
nope.
It wasn't
And
until I got here and they
and
brought it up
because
and it was like incredible.
and because in general they're not no one is like truly studying CoQ10, right? Because it's not a drug that's manufactured that makes enough money for like the big pharma companies. Ultimately money and capitalism drive all of this. Kind
Yeah.
of like how, anecdote, one of the there's been a lot of success in starving cancer, right? Doing fasting to eliminate cancer in people, but no one will study it because who would make money just teaching you how to intermittent fast, right?
Facts.
Like,
Facts.
so
Facts.
I'll summarize this for you. I mean, if you're going through this, you should read it. This is probably the best and first thing that I would start with. But the summary is stay away from BPA, which is in plastics. But also, you want to know where you're getting the most BPA into your body? Receipts. It's all over receipt paper.
Handwritten receipts. Hand
Hmm.
receipt papers are I tell people this all the time.
Yeah.
Like, you don't need that receipt.
Nope.
Tell
So
them to
stay
send
away
you
from
and
receipt.
email you one. Don't touch a receipt.
Get the plastic out of your house, have glass Tupperware
Yeah,
containers, all that stuff. Eat a Mediterranean diet if you can. Like if you're really doing this, if you're spending all this money on IVF, if you're like really struggling or you're losing babies and you're like desperate to do anything, eating a Mediterranean diet lowers inflammation. It's good for you. And then the last thing is there's like a whole section based on your factors and a vitamin regimen. And most of the vitamins you're taking come like it's right out of like I'm not saying they got it
I
from
love
here,
it.
but it matches perfect pretty much. I mean, still probably worth looking at. I followed a specific one for recurrent pregnancy loss. There is one specifically for like PCOS. Anyone out there who has polycystic ovarian syndrome? Um, PCOS women generally don't ovulate regularly. They have really, really irregular cycles. They don't always ovulate on their own. There's some other things, but if you have PCOS, there's a specific, and I think endometriosis has its own specific vitamin regimen in here.
Good
So
to
that's
know.
number one. If you are having recurrent pregnancy loss, the working womb, and this is one like it's cool because it's one doctor and it's a lot of like I'm going to call it anecdotal because he's not talking about studies conducted, but he's talking about what he sees in his clinical practice. So it's like real
Mm,
medicine, but not
yeah.
like big studies. And he like literally a lot, every other chapter is like Mary's story, Angela's story. And he tells you like what
Oh,
this
that's
one
cool
person
because it's
had.
actually this is what actually happened. Yeah.
Yeah. But his whole gist is about the placenta, like placenta science. He's like, the placenta is like the most disregarded organ. Like half the time they're not even like measuring the placenta in pregnancy. And if
Mm,
they were, you could catch so much stuff. If you were like, okay, on that anatomy scan, they will measure it. They will measure the blood flow. They'll look at where the cord is inserting into the placenta to make sure all that's normal. So they're
yep.
doing some stuff with it. But if in high risk pregnancies, if they were doing more with it, like more pregnancies could be saved, basically. This is
Mm,
his theorization. And he basically tells you, he gives you like, if this is what's happening to you, ask these questions, push your doctor for this, be a champion for yourself.
that's
Like,
incredible.
so yeah, so that's really helpful. The working womb. If you are, and I would say that this doesn't apply to you yet today, because even though you miscarried a genetically normal baby, we arguably know that it was because of your SCH. But if you're miscarrying genetically normal children, or you're constantly miscarrying your genetically normal embryos, this is your body baby friendly, and it's It's
Mm.
reproductive immunology. Okay, so we said your RE was your reproductive endocrinologist.
Yes.
That's someone who helps you get pregnant. Reproductive immunology is the study of you're having an immune system response to your pregnancy.
Ah, to your pregnancy.
Yeah.
Okay.
And there are only like 6 or 7 RIs in the United States. They all have waiting lists. So, like, if you think you have this, like, go get on somebody's waiting list. And there are some REs, like mine in Dallas, who will do a small amount of immunological testing. So, first of all, endometriosis is both immunological and uterine structural, right? It can
Yeah.
affect both of those things.
Yes.
Um, so like I don't know for you if you have had, hold on, I wrote these down. Where are they? I wanted to ask. Have you has anyone tested like your NK cells, your natural killer cells?
No.
Okay. One of the
NK cells.
yeah,
NK cells.
yeah. So one of the most common immunological responses are that when you get pregnant, and this could be because your body's reacting to something in your husband's DNA, it could be because your body reacts to inflammation. You already have a lot of inflammation, so the second something foreign happens, your body's like it mounts a response, an immunological
Mm.
response. So your natural killer cells elevate um,
Mm.
when pregnant. And there are 2 treatments for this. One is called IVIG. This doesn't matter what it stands for, but basically they're taking some of your husband's DNA, putting it into something that can be injected into you so that your body normalizes recognizing this
Ah,
foreign
yeah.
DNA. It's very
Yep.
expensive, extra experimental. A lot of times insurance won't cover it. I know somebody I know recently, they were going to try to charge them $100,000. Anyway,
Jeez, Louise. Oh my
the other
gosh.
thing you can do is you can get intralipid fat infusion. It's just this like soluble fat thing. And um, for IVF, a lot of times they'll have you do it pre-transfer, post-transfer, and then again, either maybe one other time, or some doctors even have you do it like every few weeks in your first trimester,
Oh wow.
um, to help basically keep the NK cell response down. With Maverick, so by the way, I had this test done. My RE did test me, and my natural killer cells were elevated. So we found out that, ultimately, like my host of issues is, I do think the MTHFR is creating a clotting response because using blood thinners, right, Lovenox injections, has helped. I don't make enough progesterone on my own. Um,
Mm.
I've seen now that my RE has monitored it with my son, my daughter, and I actually had another loss in September of this year.
Mm, so
Um,
sorry.
oh, thanks. Now that I've seen that, I can literally see like my progesterone starts good, it drops, we supplement, and I can keep it level, and it starts dropping, and he raises my prescription, and it keeps dropping, and until I switch to progesterone injections, which is what they normally only do for IVF, it won't sustain
Mm.
on its own. So like I need hormone support, I need a blood thinner, and I need this immunological suppression from the NK
Wow.
cells. So
Wow.
yeah. So but NK cell response for people with endometriosis who are already fighting so much inflammation is really, really common. So I would maybe ask about NK cells testing for yourself,
Yeah.
maybe MTHFR. Um, I'm trying to think anything else. Have you ever had an endometrial receptivity analysis, also
What is
called
that?
the ERA, the EMA, and the ALICE? So I don't know exactly how the test is conducted. I want to say it's like you do a mock cycle and they test something, but like they maybe your blood. Um, what they're trying to do is they're a lot of times if you're having failed transfers, so you're testing genetically normal embryos, everything looks
Mm-hmm.
good, and they're not taking.
Mm-hmm.
This tests for the timing of implementation, basically. Like they tweak your
Oh,
estrogen and progesterone doses based on the exact time that your lining is most receptive in your cycle.
I
Um,
see.
it also tests like your microbiome balance in your uterus. And it's really most useful in like IVF failure.
Mm,
again when you're having, you know, failed transfers. But like again, and I don't, we're not going to talk about how you guys are doing on this, but if you only, if like I have friends who like after 7 cycles only have 3 embryos, and like if, and to your point, you're going to have to do a surgery that could potentially damage your ovaries. So like when you guys are
mm-hmm,
ready to go after the transfers, you might be done banking. So what you've got is what you've
mm-hmm.
got.
Yep, yep.
These are some things you could do. Like you could be like, hey, we're going to throw, my friend that only had 3 embryos is throwing the book. Like I want to do every test before I do a transfer because we
Yeah.
only
So we
have
only
three
have three.
shots.
Yeah.
And so like so that yeah, so that and I'll send you all this so you don't have to like remember
Thank.
it. But yeah, the ERA, Emma Alice, that receptivity is really important for people, I think, too, um, with endometriosis.
Oh my gosh.
Yeah.
I I can't tell you. Oh my God, my dog is like being really annoying and wants to be on the couch. I cannot tell you how valuable these extra tests are because we're not there yet, right? Like we still got to
Yeah,
like get all of our bank up first. We also have to go through endometriosis surgery to get all the scar tissuing out, the excision surgery to get all of the lesions out, get the cysts out, the fibroids out. But once my uterus is now stood up, I will then be thinking about, all right, implantation. And to your point, I didn't even know some of these tests exist to make sure we have a higher shot or higher probability of the embryo taking once it gets implanted.
yep,
So this was like super, super helpful.
good. Well,
Super, super helpful.
and the last thing too you could ask is um, that you could be asking your doctor now, hey, I know there's a lot of steps from now, but what do you think my protocol will be when we transfer? Right? Like, how do you envision
Mm,
supporting my transfers, like knowing our odds and all this stuff, and just see what they say. An encouraging answer, and it doesn't mean there's anything wrong if this is not, but an encouraging answer would be given the factors standing against you with like endometriosis, age, all that stuff. We'll do something called like the kitchen sink protocol. We're going to be giving you a blood thinner. We're going to do prednisone, which is like a corticosteroid.
mm,
We're going to do this. We're going to
mm-hmm.
do that. Um, or even if they're like, oh, we don't know yet, like you want them to be thinking about the protocol that you're going to
Yeah,
use, like
yeah,
now along the
yeah,
way. We should be
yeah,
knowing what that is, or have them thinking about it. Um, Something else you can ask if you're like, if you're ever unsatisfied with an answer that your doctor gives you, if they're in a fertility practice like it sounds like you are, you can be like, hey, are you
yeah.
consulting with all the other doctors on my case? Because it's very common for them not to,
Mm,
right? But if you are a complex case, you're like, are you consulting with like the rest of the practice? Do they agree with your
yeah,
approach? Would they be adding anything else to my protocol, right? Like
yeah, that's a good point.
those are questions
That's
you
a
can
really good
ask.
point. That's a really good point. Oh my gosh, I learned so much on this. Like I'm not gonna lie. I was like, oh, it'll be like a good catch up and we'll get to share stories and be super excited. I learned so much.
I'm
Even
so
like
glad.
the whole motherfucker gene, like I'm
Yeah.
gonna get tested for the motherfucker gene. I am definitely gonna find out about NK testing. I will definitely talk to my doctor about that for sure. Because that's, again, if it's an easy blood test that they could just check, at least to know, will give us a lot more answers. Um, I really appreciate that you shared those three books with us. The first one was It Starts with an Egg. The second one was the womb work. Was it the womb?
Yeah, the working womb.
The working womb, and then the third one is your body fertile friendly? Is that the one? The third
Yeah,
one?
is your body baby friendly?
Baby friendly. Um, Love that you shared those three books. And really exciting to hear that from this crazy journey that you've been on, you at least have two
Yeah.
little babies
And I
running
tell you
around.
what, it is wild. I could not believe that like I believed it like obviously when we had our my son, I believed it. I was like, okay. But then we got pregnant, when he was just about a year old with a second. Um, and I could not believe that like I like back to back, two genetically normal babies. It just showed
Wow.
me that like Maybe I mean, it's still possible, but I'm like, I don't know that my egg quality was a problem. I think it was that like we didn't know all the things that I need to
All
stay
these
pregnant.
things.
And and like, even though I love some of my like all of my doctors actually turned out to be people that helped me get there. Not a single one of them would have done it on their own, like not even close. So like, if this is happening to you, you are the person who can make it happen, like more
Yeah,
than anyone
yeah,
else. Which is frustrating, but like also empowering, hopefully, to know.
absolutely. So you're the CEO of you're the
So,
CEO of your own health
yeah.
journey.
Yeah. And the last thing I want to say before we end this is you are such a badass and so amazing. Like, one thing I don't know if people watching understand is all those years of like the medicated cycles, the IVF drugs for 7 retrievals, the surgeries, like the testing that's painful. Like, you're also showing all those years you were showing up either at your very demanding corporate executive job or
Yeah,
running your own company, right? Starting something from the ground up, just having to behave
yeah,
like normal. Like, you're going in for one of
yeah.
those tests where like it feels like your insides got shot, and then you come
Oh
on the
my
camera and you're like,
God.
hey guys, here's what we're going to talk about today.
Like,
Like, women are unbelievable, and I'm so proud of you.
yeah.
So I'm going to
Oh, thank you, my
finish with
friend.
that.
And same for you. Like, there's a lot that I think anybody listening to this, I'm sure there's parts of it they can empathize with, either like going through any of the cycles or going through any of the testing or the exams or having the losses or whatever. This is such a topic that's not talked about, so much so that these women go through this immense pain, and men who have to support their partners going through this immense pain.
Yeah.
Um, and they go and they show up in the world and they're supposed to just show up like nothing happened.
Yeah.
And it is the hardest thing. And I'm, you know, I am glad that there are people like you who are willing to be like, hey, look, I've learned a bunch of stuff. I'll tell you what happened. My pain can't just be in vain. Like, we got to make sure others can learn from this experience and not have to go through it later.
Yeah.
So I appreciate you,
100%.
my friend.
You too, darling. Good luck as you
Thank you.
navigate the rest of these cycles. Fingers
Thank
crossed for
you.
you.
It's gonna be awesome. I'm hoping it turns out in the way it turned out for you,
Yeah.
because we are very ready to be parents, and these guys, I'm sure, will be very ready to hear a crying baby and not hear each other bark all the time.
We will manifest that. I will
Amen.
I will be doing that.
Amen, my girl. All right, go have a wonderful night. Thanks everybody for joining.
All
Talk to you
right.
later.
Bye everyone.
Bye.